As the Secret Service agents escorted Robert Walker to a secure room for further evaluation, whispers began to ripple through St. Raphael's Medical Center. The revelation that their unassuming patient was none other than the U.S. Secretary of State sent shockwaves through the hospital staff. But for Nurse Amara Okafor, the weight of this knowledge was even heavier. The atmosphere in the emergency wing had shifted. Amara could feel the scrutinizing eyes of her colleagues on her as she worked. Dr. Harold Whitman, now visibly rattled, maintained a veneer of composure, but his bitterness toward Amara only deepened. His pride had taken a significant blow, and he wasn't going to let it slide. Later that evening, as Amara sat in the break room trying to process the events of the day, her close friend and fellow nurse, Sarah, joined her. "Can you believe it?" Sarah whispered, her voice tinged with awe. "We had no idea who he was, and you handled it like a pro. You're incredible, Amara." Amara gave her a small, weary smile. "I appreciate that, Sarah. But you know how it is around here. All it takes is one misstep, and suddenly I'm unqualified again." Sarah leaned closer. "Then don't give them the chance. Keep being the amazing nurse you are, and let them see who the real problem is." Dr. Whitman. As they spoke, an alert blared over the hospital's intercom. "Code Black. Security breach in Wing C. All personnel proceed to lockdown protocol." Amara and Sarah exchanged startled glances. Code Black meant an imminent threat, and this was no coincidence. The Secret Service had been tense since Robert Walker's arrival, and now the hospital was on high alert. Chaos erupted as hospital staff scrambled to secure their respective stations. Amara's heart raced as she joined Sarah in escorting patients to safer areas. She couldn't shake the feeling that something was terribly wrong. In the midst of the commotion, Amara spotted one of the Secret Service agents, Agent Clark, gesturing urgently for her attention. "Nurse Okafor, I need you to come with me. It's about Mr. Walker." Amara hesitated, glancing at Sarah, who nodded her encouragement. "Go," Sarah whispered. "He needs you." Following Agent Clark, Amara found herself in a dimly lit observation room where Robert lay in his hospital bed, surrounded by monitors and flanked by 2 armed agents. His normally composed demeanor was tinged with discomfort. "Amara," Robert said, his voice weaker than before. "I trust you. I need you to stay here." Agent Clark quickly filled her in. "There's reason to believe the security breach was orchestrated by someone targeting Mr. Walker. We need him stable and ready to move, but he's refused treatment from anyone except you." Amara's chest tightened. The weight of responsibility was immense, but she nodded. "I'll do everything I can." As she worked to stabilize Robert's condition, she couldn't help but notice the tension between the agents. Whispered arguments about classified threats and leaks within the department added another layer of intrigue. It became clear that this wasn't just about Robert's health. There were larger forces at play. Hours later, the situation escalated when Dr. Whitman barged into the observation room. His face was flushed with anger, and his voice echoed with indignation. "What's going on here? This is my hospital, and I demand to know why I've been left out of the loop." Agent Clark stepped forward, his hand resting on his holstered weapon. "Dr. Whitman, with all due respect, you're out of your depth. This is a federal matter now." Whitman's gaze shifted to Amara, who stood by Robert's bedside, monitoring his vitals. "And you," he sneered, "what makes you so special that you get to play hero in my hospital?" Amara felt a surge of anger but kept her voice steady. "This isn't about me, Dr. Whitman. It's about the patient. Maybe you should focus on what's best for him instead of your ego." Whitman took a menacing step forward, but before he could speak, Robert's voice cut through the tension. "Enough," he said, his tone firm despite his weakened state. "Dr. Whitman, if you truly care about this hospital, you'll set aside your pride and let Nurse Okafor do her job." Whitman froze, his face a mask of conflicting emotions. For a moment, it seemed as though he might argue, but then he turned and stormed out of the room. As the night wore on, Amara stayed by Robert's side, her dedication unwavering. In those quiet hours, he shared glimpses of his life. His rise to power, the sacrifices he had made, and the enemies he had garnered along the way. "You remind me of someone I knew," Robert said, his voice soft. "She was strong like you, faced adversity with grace. People like you are the backbone of this country. Amara, don't ever forget that." Before she could respond, a sudden commotion erupted outside the room. Raised voices and the sound of scuffling sent a jolt of adrenaline through Amara's veins. Agent Clark burst into the room, his expression grim. "We need to move now. The breach has been contained, but it's not safe here." Amara helped prepare Robert for transport, her hands steady despite the chaos. As they wheeled him out, she couldn't shake the feeling that this was only the beginning of a larger story. In the days that followed, the hospital returned to a semblance of normalcy, but Amara's life had changed forever. Robert Walker's public statement praising her professionalism and courage became national news, shining a spotlight on the systemic biases she had endured. Dr. Whitman's behavior was called into question, leading to an internal review that ultimately resulted in his resignation. For Amara, it wasn't about revenge. It was about justice and the hope that her experience might inspire change. As she walked through the hospital corridors, her head held high, Amara knew that her journey was far from over. But for the first time, she felt truly seen. Not just as a nurse, but as a person whose worth was undeniable. Kindly like, share, and subscribe to this channel for more. Thank you.